In Indonesia, we have a situation where many of those who contracted and then were cured of COVID-19 have been reinfected with the disease. We also heard about how the coronavirus can reinfect humans.
Now, to know more about the situation, we will now talk with Health Ministry Public Health Directorate General Secretary Ibu Siti Nadia. Hello, Ibu. Thank you so much for being here. We usually see you on Zoom, but you're actually here with us. So again, thank you so much.
Glad to have you here, Ibu.
Because the pandemic is now a little bit less control, so I think
hopefully it's gone soon.
Yeah,
hopefully. So, Ibu, research indicates that if someone has been exposed to COVID-19, he or she has a natural immunity against the virus, especially if he or she has received 3 doses of COVID-19. But how come they can still get reinfected with COVID-19? So was that a misinformation or what was it?
yeah. So I think as we are know that COVID-19 is kind of mRNA virus. So the mRNA virus, as well known in the medical information, that's the virus that usually and always getting mutation because the type of mRNA. We've seen there is a lot of virus which are, for example, they are not mRNA virus as categorized as another type of virus. Is usually they don't really have mutation. So for example, like HIV virus is not part of mRNA, so they have less mutation. So we know that when we say that the pandemic will be controlling, it means that we are going to live with this COVID-19. We say that we don't eliminate all the COVID-19 virus, but we will getting along with this virus.
Live together side by side.
The type of the virus. So that's why they keep mutation, and there is always subvariants or new variants of COVID-19. And with this mutation, sometimes the vaccination is not can prevent people for getting reinfection. That's we call it that they are able with the mutation are able to make people sick, but the symptoms and the severity is very, very less.
All right. Well, since you mentioned that it's still mutating, but now we've seen businesses, schools, and people travel so highly in terms of frequency because they really want to go out of the country and have holidays, maybe businesses as well. It's almost back to normalcy. So how do you think we can actually stop or trying to avoid people from being reinfected?
Yeah, so first we need to complete our vaccination by getting the booster. We know from the research that if someone have a booster, they have less. It's only like 5 times chance to getting reinfection. If you are not getting any vaccination, it's like 28 times more you will getting infection. And if you have like 2 doses of vaccination, it will be like 15 until 10 times the chance that you getting a vaccination. So the first thing, complete your vaccination. We know that the booster vaccination currently is achieving like 53 million people out of 180 million that we aim to getting the booster. So this is the time, as we know that number of positive cases is a little bit increasing, if we compare like yesterday, like 5,200 confirmed case, but we seen the death case or the severe case that hospitalized, it's still less than 3% for the bed occupation rate, and for the death case is still less than 20 cases. So it's showing us that currently, although the number of the cases is increasing, but still it's still on the safety range. So we might not have any 4th wave because of this condition. We seen from like UK or other country like South Africa, they have already reached the peak of the BA4, BA5. Currently we have heard again there is a new subvariant, BA 2.75. So it seems that Indonesia currently mostly because of the subvariant of BA.5, because more than 80% that from our whole genome sequencing test, it comes from the BA.5. So we've seen, based on the learning from other countries, the number is not getting for the fourth wave.
Are we already on the top of the wave, or do you think that we are still climbing up?
We've seen there is a climbing situation, because now BA.5 is the majority of the variants that in Indonesia, but we know that I think we already detect BA.2.75. So currently, all the epidemiologists still try to elaborate more the information, because it seems the peak case that previously we are expecting on the 3rd or 4th weeks of July, it might be a little bit shifting to August, but still we continue to observe this, especially the pilgrim are getting back from. So in terms to prevent this, complete your vaccination, and then once again, the health protocol. So you need to keep your mask
and hygiene.
That's right. And I know you, speaking of booster shots, I think with the new regulations that people have to get their booster shot to enter public
malls,
facilities now, malls and other places, I think, I mean, hopefully the rates will go up soon. But Ibu, I was curious too, do mothers have a high risk of contracting or recontracting COVID-19? Because we heard that, I mean, there are records that shows that those who have been reinfected 5 times. That's out of this world, because I've heard people getting like the 2nd time or 3rd time, but 5 times, that's a lot of time to be getting COVID.
Yeah. I think it's many factors contribute when someone is getting infection more than 2 or more than 3. But of course, first, if we seen from our data, mostly people is getting reinfection like twice or 3rd time. So mostly on that range of that number. But still, we got the number of people that have not been get reinfection. Especially the one that, if we elaborate more, the one who really implement the health protocol. So I think depends on the situation. Of course, if you have only 2nd dose of vaccination, we seen from our data, mostly the people will getting infection or reinfection. But if you have like 3 dose of vaccination, you have less number. It's only like 12% that getting reinfection among that already got the 2nd dose, the 3rd dose. But if we seen from our data, the one who get the only the 2nd dose is about like 20%. And if people only get 1 shot, it increased up to 40% that getting reinfection.
But what is the severity of the reinfection? I mean, when people get reinfected, does it mean that they will have, worse severity compared to the one who had just have it for the first time?
Yeah. From our hospitalized data, is mostly the one who currently hospitalized is the one who not yet getting vaccination.
So this is for the very first time.
And then the second, they only get 1 shot. So we did not see really the number of patients who already getting the booster or the vaccination getting hospitalized. But many people who have already 2nd or the 3rd vaccination, they usually getting reinfection, but mostly it's not, they don't have any symptoms, and usually within like 3 days, they're getting negative from their
so
PCR test.
quite rapidly recovering from the virus.
Yeah, so again, it's very important to get your booster shot. And Ibu, I mean, talking about antibodies, how long does antibodies remain after a COVID-19 infection?
Yeah. So that's why we always encourage people, when you got infective, if you have less symptoms, usually your
immunity
antibody titer is not as high when you have like severe symptom. So that's why if you getting infection, but you don't have any symptoms, or you very have a mild symptom, at least within 1 month you need continue your vaccination.
Right.
But if you have hospitalized or you have a severe symptom, at least 3 months,
3 months.
after that. So, but in general, our titer antibody, it will stay like for 6 months, and sometimes is more than 8 months. The current study saying that we found that the length of the titer antibody in our.
So the most severe that you get, it is
The highest titer you will have.
triggering the immunity to be built better.
Yeah.
But
But that one, if you got the immunity when you are getting sick or you getting infection, the way that you getting immunity without any painful, I said, because you will not have any symptoms or you don't need to have experience hospitalized. So it's better getting vaccination, because the
true.
vaccination is something that
preventing.
will ensure you, yes, you will ensure you to have high titer antibody without experiencing any sick.
All right. Ibu, recently we also heard about not only reinfection, but also reactivation. Now, can you elaborate? What is it and what's the difference?
Yeah, some say that the virus, we know that currently we don't have any drugs that really cure the patient of the COVID-19. And then we have said that some patient getting the symptoms that we call it the long COVID. Yeah. So we found that very short between when they are cured, they are we call it the cure, but later they got infected again. So this is something that this is related the previous question, yeah. How long the titer antibody? We expect is between 1 month until 3 months that you might need to have another vaccination. But some people getting infection again after or less than 1 month. So it's very short period. So we call it might be reactivation, not reinfection, because reinfection is mean the new virus getting infected to your body. But reinfection, we call it, you're supposed to have quite enough titer antibody, but within that period, you already get sick again.
In some people, the case is like you're getting tested positive, and then after 2 weeks, you are still positive. What happens?
Maybe because it depends, yeah. If we getting test from the PCR, they might be the test still detect any part of the virus.
Right.
Yeah. We do not really see this is a live virus or it's just like a part of a dead virus.
Yeah,
so because you know the PCR is the one who very sensitive.
Yep.
So it might be they have positive, but after maybe 2 days after your test, you might be already negative because it's just like some part of the virus.
Now, Ibu, you mentioned about COVID-19 variant BA.2.75. So recently, the Bali Provincial COVID-19 Handling Task Force revealed the condition of a patient with that variant, or Centaurus, if I'm not mistaken. Now, so how are health authorities handling the patient, and how do they manage the symptoms?
Yes, currently like 260, what we call it, the subvariant of BA.2.75 already reported. It's like around 10 countries already detect these new subvariants mostly, but these subvariants come from India. We learn, you know, the Delta variant is come from India, so that's why the world little bit alert on this situation. But if we seen from the report from India or other countries, they have less infectious than BA1 or BA2. The number in India quite high, but again, they are not as severe from other subvariant. The current authority, of course, the whole genome sequencing tests are continue, not only in Bali. For example, in Cengkareng currently, we do in Suta port that all the pilgrim need to be tested. Previously, the one who only has the symptoms or
And now
the one
everybody
who, now
needs to have the
everybody, yeah, because of this condition. So we increasing our alert, especially the one who travel from outside the country. Special and of course, like in Bali, when we found these first cases, we again try to monitor the number that travelers come to Indonesia.
But what about, Ibu, now, as I mentioned before, the normalcy is back. People have gone back to school as well, students especially, and they're not getting boosted because they're under 18 years old.
Yes.
And I've seen in my children's school, they sometimes close out one class because one tested positive. So what do you think the protocol should be handled in this way? I mean, we are trying to get out of the pandemic to the endemic, but is this the right protocol to do?
Yeah, in terms of the school, we still allowing the school to have like
In-person class?
Yeah. So if there is children or the student who getting positive, so the standard is still again if we found any symptoms, they need to go to check for this. So we did not again do the test for everybody. So it's only now currently monitoring the symptoms and if there is any positive cases. Yeah. So again, we did not stop the study in the school. So like previously when we have found one positive case, so we closed the school. No, we still opening the school, and if there is some student have the symptom, they not allowed to go to the school, then they need to go to the test. Because why we do this policy, we know the number of children under 18 years old or even below 6 years old who got infected is very small number. It's only like below than 5%. And then very less severity among the children, except for the children who have like any congenital disease
Underlying
or
disease.
underlying disease. So we seen with this condition, the school still can be open.
Right.
Of course, we in certain condition, the teacher should be getting booster, and then the children who meet the criteria need again to have a second dose, and then the one who not meet the criteria, of course we educate the parents, and then the teacher should be getting booster too.
Now, Ibu, talking about booster, one last question before we go. Malaysia just announces today that they will start booster number 2 for the elderly. So for Indonesia, do you think that's something that you see in the future, sometime soon, or we still waiting
Second
for a
booster.
while now?
That might be a potential policy, but still, we still waiting for our next sero survey because we still monitor whether the immunity among the population or among individually is still high. You know that the first our sero prevalence surveys that mention all like 96% of people already have the antibody in their immunity. So that's why we still see, if it is like 96%, it's still very high. We don't really need the next booster. Yeah, but again, our homework is we need to complete the
done with the
vaccination
first
for the elderly because currently it's still 80% elderly getting vaccination.
Oh, 80%.
Yeah, so I think while Malaysia put on this policy because they seen the risk among the elderly is quite high. This is the same thing in Indonesia. From the data from 1st January until 13 June, we seen the number that hospitalized still a lot of elderly.
All right. Well, Ibu, thank you so much. We hope that we can tackle this pandemic very soon and get out from, this 2.5 years, almost 3 years of pandemic so far. Thank you so much, Ibu Siti Nadia Supari, for sharing with us in 3 Hour News Show.